The effective application of science and technology to provide solutions to issues which emerge as the planet evolves is often what differentiates the haves and the have-nots in the Committee of Nations. Cutting-edge technology in the construction, automobile, and other key manufacturing platforms have helped societies move up the ladder of competence in creating wealth and ensuring the availability of some key services. In the early part of the 20th century, a unique technology made its entry: modern biotechnology, the use of living systems and organisms to develop or make products. It also refers to any technology, application that uses biological systems, living organisms, and their derivatives to make or modify products or processes for specific use. As it is with processes which involve deep research and many laboratory procedures, this technology also needs proper monitoring to ensure that hazards which may occur are confined solely to the laboratories with no health or ecological consequences. National biosafety authorities have a wide range of responsibilities. These include the general administration of biosafety processes in the country, development of biosafety policy, staff training, outreach and training for stakeholders and the public, interaction with regional and international stakeholders, and keeping politicians informed about national biosafety. The components of National Biosafety Framework (NBF) are interdependent. The National Policy on Biosafety provides the rationale for the development of regulatory system for biotechnology and guides how decisions will be made regarding development, testing, and the use of genetically modified organisms, GMOs. The regulatory system forms the basis for the administrative systems for handling applications and decision-making, systems for follow-up and compliance, as well as mechanisms for public awareness, education, participation, and access to information. The National Biosafety Management Agency (NBMA) came into force on the 18th of April 2015 with the aim to provide a regulatory framework, institutional and administrative mechanisms for safety measures in the application of modern biotechnology in Nigeria, with the view to preventing any adverse effect on human health, animals, plants, and the environment. The NBMA is established in conformity with the national and international laws, procedures, and rules that govern the safe adoption of modern biotechnology practice and use of genetically modified organisms, GMOs. The NBMA Act of 2015 is the only safe value for adoption of modern biotechnology and the deployment and use of GMOs in Nigeria's socio-economic development. The Act seeks, amongst others, to provide the derived benefits from biotechnology under a legal framework for economic growth, improved agriculture, job and wealth creation, as well as industrial growth and sustainable environment. It also aims to minimize risks to human health and confirm as well as harness the potentials of modern biotechnology, guard against any socio-economic consequences, give confidence in the practice of modern biotechnology, use and handling of GMOs and GM products, reaffirm Nigeria's commitment to the principles of international agreements and treaties, to Convention on Biological Diversity (CBD) and the Cartagena Protocol on Biosafety (CPB). Proper regulation of imported GM products so that Nigeria will not be a dumping ground for GMOs and products. With these as its working brief, the NBMA has undertaken many interventions in its sector, which include accreditation of institutes and certification of facilities for modern biotechnology practice. The institutions are the National Roots Crops Research Institutes, NRCRI, Umudike, Abia State, Institute for Agricultural Research, IAR, Zaria, Federal University of Technology, Futa, Akure, National Biotechnology Development Agency, NABDA, Abuja, and the National Cereals Research Institute, NCRI, Badegi. This led to the granting of permits for confined field trials and commercial release of GMOs.
Currently, we have confined field trials being driven by Nigerian scientists. So when you say whether Nigeria is ready, people say Nigeria is ready, using Nigeria ready, Nigeria. This technology is about 21 years old. When will Nigeria grow? A child must grow, walk, crawl, walk, and run. Nigeria is overripe for this technology. We have the enabling environment for Nigeria to try. And let me also tell you, this technology is moving beyond the movement of gene from another organism to another. We are not talking about gene editing. If Nigeria does not position itself strategically, globally, Nigeria will become a dumping ground. And I can tell you one thing, there is no boundary to the movement of this product of this technology.
It's not just agri-biotech that is the technology. We have the medical biotech, the environmental biotech, the industrial biotech. So all these ones are there. And then when you look at medicine, nobody is even fighting about it. You talk about insulin that people take when they have diabetes. It is a genetically modified. So, but when it comes to food now, people are worried that they want to know what they are going to inject.
Administrative systems for handling applications, decision-making on GMOs, monitoring, inspections, and enforcement of biosafety decisions form a central pillar of any national biosafety framework. Countries wishing to enable access to genetically modified biotechnology tools will need to set up an appropriate administrative system that builds on existing systems and is able to implement the regulatory system required by national biosafety regulations and policy. The biosafety review process involves a large volume of documentation, movement of documents, and tracking of input and responses from many stakeholders. Add to this the requirement for securing confidential business information and the legal nature of the decisions that will derive from the biosafety reviews, and it becomes clear that the National Biosafety Office needs to be well managed and functional in all aspects of its administration. In developing a regulatory system to suit the requirements of a country, the relevant government bodies must develop and implement administrative systems that will enable them carry out the day-to-day activities required by the legislation. In many cases, these can build on the current systems rather than creating new, standalone entities. It may be more effective to build onto an existing administrative system rather than creating something entirely new. However, the choice of how to develop the administrative system will depend on each country's particular situation, needs, and priorities. Nigeria spans different climatic and ecological zones and therefore occupies a unique geographical position in Africa. The diversity of the country's natural ecosystems ranges from semi-arid savanna to mountain forests, rich seasonal floodplain environments, rainforests, vast freshwater swamp forests, and diverse coastal vegetation. Nigeria's Niger Delta contains the largest tract of mangrove in Africa. Variable climatic conditions and physical features have endowed Nigeria with some of the richest flora and fauna in the country. The economy is characterized by a large rural-based traditional sector. Although Nigeria derives about 80% of its external earnings from the oil sector, the agricultural sector contributes about 38% towards the gross domestic product, GDP. About 70% of the population derives its means of livelihood from agriculture, while the commercial value of biological diversity in Nigeria exceeds the cost of conservation measures by more than $3 billion, according to 1993 valuation. Biodiversity conservation has not been recognized as a feasible investment in Nigeria's economic development. Natural resources valuation has not been fully incorporated into national economic planning. In 2001, it was estimated that conservation costs to Nigeria were about 3.8% of the gross domestic product, while the aggregate contribution of biodiversity to the GDP was about 46%. The benefit of biodiversity to Nigeria is over 8 billion per annum. Non-timber forest products are used for food, medicines, oil, resin, tannin, household equipment, fuel wood, furniture, and building materials. Subsistence rural dwellers are continuing to exploit these products for income generation. The Nigerian National Biosafety Act provides a legal framework for the deployment and domestication of modern technology in Nigeria. All line federal ministries, agencies and departments and stakeholders made inputs into it and adopted it. The Biosafety Act, which is the outcome of the bill, has provided a legal impetus for the regulation of modern biotechnology activities. The adoption of modern biotechnology under a legal framework would assist research institutes and other organizations that have the mandate to promote biotechnology activities in the fulfillment of their set mandates by using the technology to enhance food security, fight malnutrition, alleviate poverty and hunger, and enhance the environment.
Nigeria has prepared enough scientists that understand the importance, and that is why the scientists keep harping on the fact that Nigeria cannot be left out. This is so important. This is so important that we must not be left behind. And so you can imagine Professor Tannin Ison, who is much older than me. So if I'm saying for my own generation we are being left behind, you can imagine what is happening, the gap between what is happening and his own generation. But because our scientists already have the fundamental knowledge, the basic knowledge required to follow through, we are aware that this is not a field that Nigeria can afford to overlook. It is so important, so fundamental to driving the economy of any nation. And those nations that have embraced it fully are already reaping huge dividends.
Having a biosafety law is the only sure guard against indiscriminate dumping of genetically modified organisms into the environment and market, to ensure that products of genetically modified organisms, GMOs, are certified fit for the environment and human health.
If we are practicing biotechnology and there is no biosafety law, it is dangerous, because in some cases you are dealing with organisms that could be dangerous. And the biosafety regulation is a protocol for ensuring that the public is not endangered. It's not dealing with biosafety regulation, it's not dealing with the GMO products only. It's dealing with the whole setup of laboratory, how you dispose of radioactive materials used in your experiment, how you handle microorganisms, not necessarily that of GMO. So the attention focused on GMO vis-a-vis biosafety is wrong. It's purely due to ignorance. And in fact, without the biosafety regulation, the GMO cannot come to this country. So it is the GMO that emboldens us, that gives us that confidence that, okay, let them bring the GMO, let's subject them to tests which have been done in other places.
The experience of the creation of a Biosafety Act in Nigeria dates back to 1994, when the first national biosafety guidelines were produced as an interim regulatory instrument in Nigeria. This paved way for the development of a national biosafety framework in 2001, which consists mainly of biosafety policy and the Biosafety Draft Bill. Nigeria started biosafety activities with the development of the following guidelines. The 1994 Safety Guidelines, which were developed by the Federal Ministry of Agriculture and were specifically for agricultural sector pre-Cartagena Protocol on biosafety. They were, however, not put into use because they did not meet the required Nigeria biosafety standard. The 2001 National Biosafety Guidelines, which were developed through the participation of relevant stakeholders involving line government agencies, non-governmental organizations, NGOs, and individuals knowledgeable in biodiversity conservation, biotechnology, and biosafety. It was developed after the signing of the Cartagena Protocol on Biosafety, and it was in line with the protocol. The National Biosafety Framework, NBF, which is in line with the protocol, signed in 2000 and ratified by Nigeria in 2003. It requires countries that are parties to it to develop national administrative and legal frameworks as a way of domesticating the protocol. Nigeria developed a National Biosafety Framework in 2006, which consists of, among others, the Biosafety Bill and the Biosafety Policy. The NBF is to ensure that the safety of the practice of modern biotechnology, handling, and the use of its products, that is GMOs, that may have adverse effects on conservation and sustainable use of biodiversity, taking into account risks to human health.
GM crops have been found to be safe. Numerous agencies across the world have established, including the European agencies, that GM crops are as safe as conventional crops, the products that have been adopted to date.
As of 2016, there's some 180 million hectares of GM crops were planted worldwide in leading countries, leading agriculture countries such as Brazil, China, India, also Canada, United States, Argentina are lead countries in where farmers have adopted genetically modified crops in a at a very high rate. So with 20 years of experience from those countries, what we know is that there's not a single evidence-based report that shows the environmental or human health harm of these crops, of this technology.
National Biosafety Policy 2006, with the overall objective of providing a regulatory regime and guidance for the sustainable development of the science of modern biotechnology, its application, and safe use of its products without prejudice and risk to public health, environmental health, national sovereignty, human dignity, and fundamental human rights. The national biosafety legislation basically sought to develop a holistic mechanism for the safe research, application, and use of modern biotechnology aimed at identifying and minimizing the potential adverse effect on the conservation and sustainable use of biological diversity, including risk to human health. The drafting of the safety bill passed through various stages, and some of the stages include the review of relevant international treaties, of which the Convention on Biological Diversity and the Cartagena Protocol on Biosafety were considered to be the major ones. This is in recognition of the interdependence of the different environmental components, their impact on the ecosystem, and the fact that the environment has no national boundaries. Review of existing relevant national laws that impact on the use of modern biotechnology, including research, development, safety, management, and general commerce in genetically modified organisms and living modified organisms, LMOs.
In our law, we have said that every food or feed that has GM, up to 4% should be labeled. And so we do check out for these things. If a food or feed is in the market and it has GM as much as up to 4% and is not labeled as in GM, we do have the authority via the law to sanction such a shop or a store that sells such products.
16 members drawn from line federal ministries, civil society groups, and individuals with cognate experience on issues of biotechnology and biodiversity conservation. In carrying out its duties, the committee had various stakeholders and consultative meetings and workshops. A draft biosafety bill and biosafety policy were two of the documents that the committees came up with. These documents were further subjected to various stakeholders' review sessions. The draft biosafety bill was in particular subjected to a broad range of legal experts.
During the procedure for the drafting of the biosafety law of the country, the experts in biotechnology, the experts in genetic sciences, experts in anything molecular biology were called for series of meetings and trainings. We were called several times for dialogue, for trainings on the need, the attainment, and the necessity that this kind of law required in a country like Nigeria. As part of the training procedure, we went through down the lane of Cartagena protocols of several years of diversity convention. We went through series of trainings that did not only involve scientists, but even stakeholders in the custom, stakeholders in food, drug, and public that will be involved in anything about safety.
To say that the biosafety regulation or biosafety law was hastily, enacted is an act of ignorance, because here the process of passage of bills is very transparent, and transparent in the sense that all stakeholders will definitely have a say. When the bill is being sponsored either by as a private member bill or an executive bill, it is read 3 times in Senate. The first reading, it will be read by entire 2. The second reading, there will be a lead debate on that bill, which will give every member of Senate to contribute to that debate, and the merits and the demerits of such a bill. Just as we are doing it in Senate, the House of Representatives is also doing it. So it's not something that is done secretly in Senate. The House of Representatives is also doing it, following the same procedure. First reading, second reading, third reading.
All the due process of enactment into law has been followed. The bill was properly introduced before the floor of both chambers. It was read for the first time. It came up for second reading. Extensive debate was conducted. Then it was referred to the relevant committee, and the relevant committee did public hearing, whereby it was advertised in 2 major national newspapers as well as the electronic media, inviting all stakeholders to come and give their opinion as to the passage or otherwise of that law. And all stakeholders that are willing, some submitted their memoranda, right? Some came forward physically to chip in a word or two as to the advantage or otherwise of the passage of the biosafety bill and the subsequent enactment of the national establishment of the National Biosafety Management Agency. Public hearing was done. The committee submitted its report to the House. The House considered the report of the committee in the committee of report. It was adopted. It came up for third reading, and then it was subsequently transmitted to Mr. President for assent, and Mr. President gave its assent. So that is the procedure.
The law we have in place is a good starting point. A law is a living document, and if the need arises, any aspect of the law can be amended. People tend to think that this law was done in a hurry. I will tell you that members of the then House of Rep actually had a retreat with stakeholders in the city of Kaduna. The law was presented in the first instance, it didn't sail through. Then it sailed through eventually in 2015. This law has taken almost 20 years in the making. There was no hurry in doing this law. It's a good beginning.
It is not out of place to have a law and also have some bits and pieces of some gaps in every law. There is no law that is perfect anywhere in any country. So ours is not an exception. But I must say that we have borrowed from what we have existing in other climes to ensure that we have a very solid, watertight enactment in that very law. So what we can do as Nigerians is to ensure that we roll out the implementation of that act itself, draw lessons from there, and also improve on provisions subsequently if there is need. But I think that the provisions of that act have laid a very solid foundation.
To ensure the global best practices in the sector and achieve successful transfer of technology, African governments are expected to provide the required political leadership. Also, multinational companies and the African sector, which stand to benefit most from biotechnology adoption, are expected to be more committed to Africa. The African public research sector, farmers, and consumers are the pillars on which this success will rest.
The issue of human capacity on biosafety, I will tell you, we have some of the best hands in Africa. Some of my colleagues, including myself, we have had training under the Secretariat of the Convention on Biological Diversity on biosafety matters. We have had training under the Institute of International Center for Genetic Engineering and Biotechnology, Biosafety. The first international training I had in 2001 was under the auspices of International Center for Genetic Engineering and Biotechnology. Then some of my colleagues have also had that training. Then also had training too at Norway. I had training, in fact, all over the world. And I can tell you, some of the staff of the agency too have had masters on biosafety related courses. And when you say masters, some people will say, is it common masters we are talking about? There is no degree that is higher than masters in biosafety related courses over the world. So we have had the opportunity to have that. Within the country, we have also had trainings, in-house trainings. Under the Global Environment Facilities training, we have also had various capacity building programs. Staff have been trained on risk assessment, risk management, inspection, a lot of things. I think the hands of staff we have, they are very much adequate to address the issue of biosafety in this country.
I've been trained both home and abroad just for the sake of this GM detection. I don't think the question of my competency is anything to talk about, to argue about, and same for all the staff that are in this very laboratory. We do have all the equipment here in this, though it is small, so to say, but we do have everything we need to carry out our work.
Funding agencies are also expected to ensure international and Africa-based organizations are supported in an equitable way that enhances harmony. There is an urgent need to support a wider base of African local organizations to demonstrate the benefits of biotechnology and to build local expertise of African scientists.
We are looking towards a situation where we have a holistic biosafety in Nigeria, where Nigerians, we can wake up and be sure that we have an agency that can protect us. We have an agency that says it's safe, it's not safe, and they will believe a holistic biosafety system.